Ladies and gentlemen, it's a great pleasure to present to you today about how digital technology can transform healthcare and fight life-threatening diseases such as cancer. The first slide, please. That works much better. So, technology that helps to fight cancer. Cancer is probably something that many of you have friends, family members that underwent treatments for sophisticated software already today, made all the difference. And half of the people here in this room are going to be fighting at some point a critical disease where technology today can be crucial, especially software-driven technology. Software from Brainlab is today in use in over 5,000 hospitals in 100 countries.
Cancer, the emperor of all maladies. It is a frightening disease for which currently there's no cure.
My oncologist suggested a brain scan because I hadn't had that tested. There were 3 tumors.
We are unquestionably in one of the most dynamic and exciting periods of medicine for cancer treatment.
We really have to think about what their quality of life is going to be, and quality of life starts with what's up here.
I no longer think about dying, I don't. And that's, I think, pretty dramatic.
Well, what first comes to mind when talking about digital health are all the apps and wearables that help improving management of chronic diseases such as diabetes, or all the applications that help with driving up the efficiency of an interaction between the patient and a physician. And then there are all the promising advancements through the decoding of the human genome. Brainlab, in contrast, is digitizing surgery. The operating room is the #1 value driver of a hospital, but it is also the biggest efficiency leak. In order to improve the access and consistency of treatments, and in order to disseminate knowledge and best practice, one must digitize surgery, a pretty analog thing today. And in order to, when digitizing surgery, we're able to optimize and personalize treatments for every individual patient. How do we do that? Or how do you get into writing software for medicine? Well, for me, it all started over 30 years ago. I got my first computer at the age of 15. And when you don't get into computers at the age of 7, you're probably not going to be very good at software, and I was probably the worst software engineer to ever work at Brainlab. But I knew whom to hire. So with 16, I wrote a book on 3D software, and that book went on to sell 50,000 copies in the first year. And that book resulted in my being invited by the University of Vienna to join them for some special computer project in neurosurgery. And through that project, I saw the first images from computer tomography and magnetic resonance tomography, and I couldn't believe that this high precision from those images wasn't used in a better way for surgery, that people would put up those images in the light box in the corner of the room. And surgery started manually. So for me, it was clear that software was the missing link. That's how I looked like 30 years ago. And so 30 years ago, before there was even computers, we used a Commodore Amiga gaming console because Windows 3.1 wasn't out and there was no Pentium chip, for example. We tried to digitize the anatomy and correlate the distances and relation between the different structures. And that's what we do today at scale at thousands of hospitals around the world. What I want to demonstrate today and what our technology achieves today is generating a digital copy of the patient, a digital twin. For that purpose, we need to aggregate and correlate images from a number of different sources. And when comparing two data sets of the same patient, This is very difficult because they may be from different scanners, depict different angles of the anatomy, and show different physical properties. So it is crucial that all those images are being brought in the same spatial frame of reference. We achieve that by a synthetic atlas of the patient, of the human anatomy, that allows us to map every anatomic feature of the patient. It is not a static atlas, but it contains knowledge about the variability patient to patient, how a particular imaging modality depicts muscle, body fat, or gray matter. So this can be described like a Google Maps for the human anatomy. But while there is only one world, we have to be able to map over 7 billion patients. We are able to assign an anatomical address to every location in the patient's anatomy, in any one of those images. So we're able to distinguish hundreds of structures and thousands of landmarks. And we need to do that consistently, patient to patient. And even if you're looking for a particular tumor in a large database of patients, we're not able to only distinguish them by type and by location, but also by shape. And this anatomical mapping allows us to better visualize our anatomical and our digital twin of the patient. We are able to peel off the different anatomical layers, like the layers of an onion, providing surgeons with better insights into anatomy. And those insights can be provided for a very broad range of anatomical structures. And this is something that is really giving us a full library of capabilities to better visualize data. So how do surgeons today interact with that on a day-to-day basis? So this is the picture of the Brainlab bus system, which is the gateway of surgeons to access digital data. There's complete hospitals ground up, like NYU in New York, and one of the hospitals where every operating room, every surgeon is accessing data through the Brainlab interface. And I now want to demonstrate you, I brought one of those with me, how this is being done. So as a gateway for all the digital data, we're able to, for example, take endoscopic information and stream it to a different data set. We're able to take vital signs and are able to route them somewhere else. So by controlling all the digital data flow, we're able to even record the data and also run AI-based algorithms on them, so we generate additional information and content for the information. So now I want to go and look at just my patient's anatomy and bring that up here. So I can pull up the images, I can scroll through them, and everybody seeing that says, well, that just works like the iPhone. However, we introduced that technology 6 months before the iPhone came out. We took the idea from the movie Minority Report. You can take also that anatomy, rotate it. And so now I want to add a tumor to my data set. So I can now go and pull up an AI-based brush tool that allows me to outline the information. And I can simply take a brush tool in this area of what is depicted here as a tumor. The surgeon can just identify roughly what the tumor is, and I've generated a 3D representation of my tumor. So now I want to add fiber tracks, this colorful structure that you've seen just before. And I do that by, again, bringing up this view, and I now want to see everything of all of those fibers that are connected, through the brainstem. So we can now, rotate that. I can change the parameters, but I only want to see the fibers that are passing through the tumor that I've just outlined. So I pull up the tumor to my structure here, and now we can basically say, well, there's a few fibers that are not really meant to be there, but now I can take this and rotate it, and I see how those fibers wrap around the tumor as I'm approaching my patient. So this is a database that gets all the information together in one digital copy of the patient. So now the next challenge is how can we aggregate that data so we can also use it for AI and machine learning. So in addition to the data already stored at hospitals and the electronic medical records and genetic information, we're adding the anatomical information in a computer processable format. And we're able to define from that patient-specific statistical charts. And we can also map the patient's anatomy together with statistical information. So we can create statistical volumetric maps that can predict, for example, certain risks. In this case, it shows the resectability of a tumor mapped onto a specific patient. So a very exciting opportunity to have better objective decision-making tools for otherwise the personal subjective experience, so both together can provide the best outcomes for a patient. So now we need to map this digital world to the physical world. And in radiation therapy, we can achieve that by using the Brainlab exact system. First of all, we have structured light that is scanning the surface of the patient, and we also have a thermal signature that is co-registered to the same space in the same frame of reference. So we're using a hybrid of different sensors to create a very stable and a dynamic link between the digital world and the physical world. And then there is X-rays shot from two different angles that allow us to capture the internal anatomy of the patient. So these are all methods that are required to make radiation therapy safe. In brain tumors, for example, we can aim high-energy radiation beams from different angles onto all the same tumor, so that at a very high concentration at the intersection of those beams, we can effectively burn away brain tissue. So it's in a single treatment, you can effectively treat a brain tumor, for example, with a sub-millimeter precision. So it shows how precise those two worlds, the digital and the physical world, need to be correlated. The same is also possible in surgery. So in principle, if we're going to the operating room, we also use a GPS system for the human body to establish and generate that correlation. So that's what I will show here. So don't worry, it's just only a rubber head. I'm not going to do harm to any patient. So this is my instrument that I can track. The cameras here would pick up the position of my pointer. And as I move this around, you'll be able to see then the image of navigation. And if I bring that here, you can actually see that on the large screen as well. So by moving my pointer over the head, you see where the tumor is just underneath my pointer. So that's where I need to make a cut. So I'll go and simulate what that cut would look like. And now I can rotate that and see that, in fact, I'm just above the tumor. I can remove here my little flap, and now I'm navigating, and you can see how I would be able to then pass by those fiber tracks that I've just identified. So this GPS system isn't just available, in the brain, but you can use the same technology to when you get down to the tumor, to digitize the progression of the tumor. Since we know at any given point in time where the instrument is anatomically, I'm able to then go and really digitize the progression of surgery. Or I can insert a catheter with a very high precision, or insert a spinal implant. So there's many ways of how this GPS system for the body may be applied. And I can even pick the perfect shape and size of a knee or hip implant to ensure that it ends up exactly where it is supposed to go. All the images are based on data that was obtained prior to surgery, and we can now take data during surgery with this intraoperative CT scanner, or even better, we put the same tracking technology on a ultrasound probe, and we're able to then co-register that to our space. So going back to our digital model of the brain and the ability of how that was mapped, all the different structures and every voxel of tissue has properties assigned, elasticity, and also how that will change through a finite element model. So we can model any biomechanical changes. And so now with this intraoperative information, we're able, visualized by those vectors, even if there's incomplete information from just one plane of ultrasound, we can simulate how the tissue is changing in 3D. So this is really the crucial technology to bring navigation also into other parts of the body where the tissue is more elastic. And then now, as we have established a super high accuracy and correlation, what is missing is, of course, robotics to more precisely implement those features. So we've designed a very clever and compact robotic arm that can just be positioned into a coarse position, and then the robotic wrist will adjust just in a fine movement the trajectory to perfectly capture the exact position that we want to hit and we want to treat. So from robotics, I'm going to the microscope, which nowadays is also a robotic device to be used in surgery. And a microscope is the most important tool of a neurosurgeon, but with the software from Brainlab, we're even taking it to a whole different level. And I'm just basically bringing up my microscope view here, so that you can also follow what I'm doing here. And as I take the microscope and aim with the microscope here onto my tumor, then obviously I can only see the exposed part of the brain. However, with my technology, I'm able to now also see in different layers. As I go further down, you see the fibers and how everything wraps around the tumor. So now you may believe that this is a confusing display and you may not know what is above and below my focal plane. Well, I can simply take the plane and rotate it so that you can actually see which of the structures are wrapping around that. So we can see how in my single model I've been able to bring all the information together and merge into one application. And I'm also able to use my pointer and aim it at a particular position and have the microscope basically then re-aim at that. So if I'm pointing here, then I can have the microscope. Just need to move a bit further away. No, it's too far. So now you see how the microscope is readjusting to my pointer position. So if I have a deep-seated tumor, I can even robotically control where the microscope is aiming. And, well, I've been at least able to demonstrate that part. You should never buy software from a company where the CEO can't even personally give a demo. So now this is how augmented reality is used in thousands of operating rooms every day today around the world. This is how augmented reality is going to be used in the future. And Brainlab is very excited about a very privileged relationship we have formed with Magic Leap, a Florida-based augmented or mixed reality company that has really redefined how the physical world can be merged with the digital world. And Brainlab, over the 30 years of its existence, has always leveraged technology that was available at the time to improve surgery, whether it was cloud computing, robotics, AI, etc. So now, with the convergence of communication technology and computing technology in a single device, we have now a whole and vast range of different opportunities. And this is what is really so special about Magic Leap. The vision is going way beyond just the idea of projecting an image onto the retina and injecting a virtual display into the real world. We talked about the layer of healthcare and how we have injected the healthcare layer of our digital world into the physical world. Well, there's many other layers. For example, the pipes running under our feet and the radio signals flying through the air. And all those different layers can be connected with Magic Leap, and this is like really the company positioned at the forefront of that, and we're very proud and excited about bringing that into healthcare. So one example for that perfect bridge between the digital and the physical world is shown here as a prototype Micah. You all know those AI-based assistants, Siri and Alexa, etc. And I find it always creepy if somebody is talking from the corner of the room to you. But we wanted to really bring that alive. And so again, in this prototype, the focus is on really natural gestures and mimic, so that when you talk to Micah, that you really have the sense of talking to a real person. So now the example of how you bring the digital and the physical world quite a bit closer than originally. But back to the operating room. So in order to digitize the procedure, we need also the ability to actually recognize and scan the entire room. We want to know at the end where everything is. We want to know every single task. An operating room is a black box with very little knowledge of what is done by whom and when. You get a 2-page surgery report, and that is it. We want to know when a surgeon picks up an instrument and when the surgeon puts that instrument down. And for that purpose, we have attached all those sensors to the device that are really the foundation of actually digitizing all the analog steps. So not only are we revolutionizing healthcare by bringing in all that anatomical detail, but what we are now adding is all the workflow detail to know exactly what step has been completed at what point in time. And this is how the Magic Leap device looks like in reality. So I can simply put this wearable computer here into my pockets and basically set up the device here over my head. And you have no idea what I can see now. I'm not going to tell you. But in order to give you an impression, this is what it will look like, and we have actually done a little movie that shows that impression. So we want to have the ability to look almost with X-ray eyes into the patient so that you can really see the anatomy in full detail. There's many views and many screens. We've actually unboxed software from the computer and placed it in the room. And this is like really the exciting, opportunity that we are creating. And we are really promoting a very open interface. All the things that I've just shown are not just a closed system, but the invitation to all of you to participate in creating a tremendous future for all the patients that are suffering from critical diseases. So we want to create an open interface, an environment where many entrepreneurs can contribute to better healthcare. Thank you all for listening. Thank you.